Manfred, good afternoon.
Hi, how are you doing?
I'm Dave Hodgin.
Good.
George should be with us shortly.
All right, sounds good.
I
Okay,
see
did you
George
hear
has
that,
joined
Ron?
us. Welcome, George. Darlene, Wanda,
Hi, Manfred.
Hey,
Louise,
George.
Cleophas Martinez. Okay, welcome.
Welcome to Senior Life Online. We're Scotts Valley Senior Life Association, and we're the sponsors and hosts of Senior Life Online. And there's our website address if anybody wants to track us down. We have a lot of good information there.
You want to come up?
And
Huh?
can you see it? Today's guest is Manfred Luedge. He's an insurance agent for HealthMarkets, and he'll be talking about Medicare and probably everything you want to know about updates and anything else, different programs. So he'll be talking about that. But before we start, we will just run through a few things, explain a little bit more about Scotts Valley Senior Life.
George, I'm going to put everybody on mute and then turn you back on again here.
All right.
Let's see. It should be. Well, that's not working. There we go. All right.
There it did.
There we go. Okay. Hey, George, you're not muted.
All right, I'm good to go.
Yep.
So as I was saying, you can sign up for our newsletter, and then we'll keep you appraised of all of the programs that we have coming up and future projects that we have coming up. And then if you have any suggestions for future projects, just let us know, because we're always looking for new things that we can help the community. You can find us on Facebook. We also just did a program on Facebook. So if anybody has questions about Facebook, they can find that link on our website. And donations are always deductible, or always welcome, and tax deductible. And we're an all volunteer group. So nearly 100% of donations received are used to directly help seniors living in the area. You can designate Scotts Valley Senior Life Association as your favorite charity when you shop through Amazon. I know everybody is shopping on Amazon. Whether or not you're getting your whatever it is you shop for, that's a whole nother question. But when you do shop, you can designate us as your charity, and then it doesn't cost you anything extra, and we get, I think it's 5% of each purchase. A few things that we've done for the community: we got automatic electronic defibrillators for Montevalli and Spring Lakes Park, an exercise machine for Montevalli, patio umbrellas for the Scotts Valley Senior Center. And when it's not pandemic, we usually do 2 to 3 free workshops annually on topics of senior health and education. And there's a picture of us with our donation box that was donated, actually made by one of our members. We appreciate that. And one of the programs that we're proud to support is a Scotts Valley Performing Arts Center. It's through our support for the Scotts Valley Community Theater Guild. And that will be, we're planning to do a program where we'll do a tour, because it's really coming close to fruition. And so we'll take everyone on a tour, and then we'll record it and broadcast it later. We'll also be doing it live on Facebook. And there's a picture of what it might look like. It's not really, it doesn't really look like that, does it, Dave?
Oh, it won't.
It gives you an idea. It's next to the library. So this presentation is being recorded. If you don't want to be visible, you can turn your feed, you can turn your video off and just let us know. It's a lower left-hand corner. And just let us know if you have any questions about doing that. And later on, we will be broadcasting this. We'll include a link to this program on our newsletter and on our YouTube channel. And with that, I will turn it over to Manfred Luedge, Health and Life Insurance Agent for HealthMarkets Insurance, presenting Medicare 101. And I think I was going to go run through real quickly just some of the things that he can talk about. He'll talk about Medicare Basics, who's eligible, how do you enroll, supplement versus advantage plans, what's covered and what's not, and then we'll wrap up with a question and answer session. So there you go. I'll turn it over to Manfred.
Well, thanks.
There we go.
Okay, you got all this. Get to know Medicare. Now, I do understand from George and others that the group of people looking at this and joining the meeting, most of them are already on Medicare and somewhat familiar with the basics, and I don't have to possibly spend too much time on it. And maybe we'll, after a little introductory stuff, do more like a question answer session, if that works as a format. First of all, I'd like to introduce myself and show you the screen here where you can note down my contact info for any follow-up conversations that you might want to have individually in the future. You see my California license number there, and also the fact that I'm actually licensed in a number of different states, in case you know of people who are out of the state of California and need help, I'd be able to do that as well. And then I'll go into the Medicare basics a little bit. You know, these are the main questions. George has brought them up already. Most of you are familiar, and I'm going to try and be really brief and succinct. So briefly, Medicare is a federal program of healthcare and health insurance, largely for people 65 and older, but also for some people who have a long-term disability and are under 65 years. They have also access to Medicare as their health insurance for their healthcare needs. Okay, you all know by now what the Medicare card looks like, and you know, we got this famous red, white, and blue card a couple of years back. They changed the numbers. They finally got wise and didn't put everybody's social security number on their cards. Should you still have a card with your social security number and a letter on there, you can go and get that card replaced by going to medicare.gov. Very important website. Bit overwhelming website. There's a lot of information on there, but worthwhile. And again, it's something that I help people navigate through if that occurs. As you probably all know, the original Medicare, which was started in the early 80s, consists of two main parts. Part A is related to hospital coverage, and Part B is outpatient medical coverage. Anything under 24 hours in hospital or outside of a hospital setting is handled under Part B. As you also may know, Part A typically comes without a cost associated with it. Part B does have a premium attached to it. This slide here goes into the current numbers, and though you might be curious about it. We don't have the definitive numbers, dollar amounts for 2022 on hand yet. I haven't seen them yet. But the current costs for most people, as it says here, the premium for Part A is $0. There are people of higher income levels who will have to pay a premium for their Part A. That has to do with IRMA, that is short for income-related monthly adjustment amount. So there are premiums there. These numbers typically go up every year, usually not in huge leaps and bounds, very incrementally. Part B, outpatient medical care, does have a premium attached to it, $148.50 for those who are not affected by IRMA, and a deductible of $203 annually. The projected number, that much I can say, for the premium is $10 higher, so in other words, $158.50, and the deductible is projected to go up by $14, so it's going to be about $217 in 22. But those are not completely fixed numbers yet. What we had seen in Part A, there is a relatively significant deductible, almost $1,500. And this is not an annual. This is important to understand. It's not once a year. It can be several times a year that you'll be charged this deductible of $1,484, depending on how often you have independent hospitalizations during the course of the year. And there are other costs associated with that. If you are in the unusual case of a very long stay in hospital, you will have daily copays starting on the 61st day for 3 months, for 30 days, of currently $371 a day. So that adds up really, really fast. And then after day 90, you're going into your lifetime reserve of copay days, where you have 60 days available, where it's $742. This is always double what the first 30 days are. And because of those costs, and because in Part B, because 20% of the approved amounts of any Medicare costs are on you, there is quite a bit of financial liability still left with you, even if you have what we call original Medicare Part A and B. And that financial liability is the reason people look to private insurance carriers to give them additional coverage. Okay. If you decide to do that to protect you from that financial liability, and like I said, that can be significant. There are no caps as to how much that 20% adds up to in the end over the course of a year, right? Most people opt for one of those two possibilities. Option one in red is a Medicare supplement plan, in combination typically with a standalone prescription drug plan, Part D plan. The other option in blue is a Medicare Advantage plan. And I find that a lot of times that's what people are interested in understanding, is the difference between the two. Okay, what makes a Medicare supplement plan versus what makes a Medicare Advantage plan? Are there any questions so far? Nobody coming up? I'll just go on if that's the case. So here are the main characteristics of the Medicare supplement plans. They are called supplement because that's truly what they do. They supplement your original Medicare. Your federal program that is represented by your Medicare card is your primary insurance. Your supplement plan that you buy from a private insurance carrier only comes in secondarily after the federal program has paid your providers, your doctors, your hospital, your labs, all of that, right? And they come in because the federal program doesn't pay your providers in full. There is still a bill open that you're liable for. And if you don't have a supplement plan, you would be paying those remaining costs out of pocket, right? And if you want some plain numbers, this is always based on the rates that Medicare sets for any imaginable procedure that they cover, right? They have a fixed price. And let's say you do this procedure X and Medicare says, well, this procedure is rated at $1,000 cost. Because Part B of Medicare covers only 80% of that cost, they would pay your doctor $800. Now, your doctor is not obliged to accept the rates that has Medicare set. In fact, they can exceed those rates, go beyond those rates by up to 15%. That's what's called the excess charge. And what that does is if your doctor then says, well, the $1,000 procedure that we just did, I'm charging $1,150 for that. That means you're liable for $350 all in all, right? And that's what you would like your supplement plan to cover for you. That's what you're looking for in that secondary insurance. Another important characteristic of the supplement plans is that they are not HMOs or PPOs. They do not have a network of providers other than that anybody who is able and willing to take your Medicare card and bill the federal government for their services will take your supplement plan, regardless of which supplement plan is, regardless of which carrier you got it from, regardless of whether you have a plan N or a plan K or a plan A, right? They will be accepting those plans, and the plans will kick in and be your secondary insurance based on the type of plan that you bought. Okay, for that matter, the plans in the supplement plans are highly standardized. They're named, as you probably know, by letters of the alphabet. As long as they could, people often try to get plan F, because as you can see in this grid, it's the one that fills every row, and down the column says 100% everywhere except on foreign travel, right? So it's the most complete coverage that you can get. People who became eligible for Medicare after January 1st of 2020 are not going to be able to enroll into a plan F because it's been discontinued. It is grandfathered, those who have it can maintain it and keep it. But if you're newly eligible, the best you can do is the next plan G, which, except for the row of the annual deductible, covers everything the same way plan F does. That's the only difference between the two, that the plan G will not cover the Part B deductible for you, which is currently $203, right? But you see, they're totally standardized, and every carrier has to follow that same grid, so that if you compare carriers, their plan G will be the same, whether it's Blue Shield or United Health or Humana, whatever. Any of the carriers that offer these types of plans will follow that grid, and the only difference between them really will be the monthly premium that they charge. And sometimes they give you additional optional things that often cost extra and that are not guaranteed. And they can vary from plan to plan a little bit. Since I just mentioned several companies by name, I want to take the opportunity to emphasize that this is strictly an educational meeting. It's not a sales presentation in any way, and I cannot go into numbers like, well, this plan charges that much premium and they have this kind of deductible. That kind of information has to be reserved for individual conversations that people can have afterwards at some later time. So this is generic information that applies to everybody equally, just so that that is made clear. Okay, so what I was saying about these supplement plans not being HMOs, going with anybody who can take Medicare, what that implies is your Medicare supplement plan will be accepted anywhere in the United States, right? If you're somebody who travels a lot or spends 3 months a year with the grandkids in New York State, your supplement plan will work there just as it works at home in California, right? You can do regular doctor visits, and as long as you find somebody who takes Medicare, they will take your Medicare supplement plan, and your supplement plan will pay according to the level of plan that you have. Okay. So in contrast to that, if we're looking at option 2 at the Medicare Advantage plan, the Medicare Advantage plan becomes your primary insurance. You're buying it from a private company, just like the supplement plan, but it becomes your primary insurance. You have to have original Medicare. You have to maintain your Medicare membership by paying your premium for Part B, but you leave the card at home. You don't need to take your card to your doctor, because you will go to a doctor in most cases who is part of the network and is only interested in seeing the card that you have from the private company that you bought it from, right? There are several private companies offering Advantage plans in Santa Cruz County, and there will be more plans available for 22 to look at, just so that you are aware of that. The Medicare Advantage plans, in almost all cases, and certainly the ones available in Santa Cruz County, do include prescription drug coverage into the premium for the plan. This is an important difference to the Medicare supplement plans that I haven't mentioned. The Medicare supplement plans typically these days do not include prescription drug coverage. And so if you're following option one, you get a supplement plan, you typically need to also get a standalone prescription drug plan. Okay, and we can talk about prescription drug plans in more detail later on. The Medicare Advantage plans do typically operate as HMOs or PPOs. There are a couple other variations to them. None of those are in the marketplace in Santa Cruz County. And they are obliged by law to cover at a minimum everything that original Medicare covers. What they do is they change the way you participate in the cost on those coverages. That means there are usually co-pays or co-insurances that you have to come up with when you see a doctor, when you see a specialist, and so on. And because there are these additional costs, the plans are also required to state and offer a maximum out-of-pocket amount. Those vary largely throughout the country. Typically, they are several $1,000s for the course of a year. But in some areas in California, you will find plans that have less than $1,000 annual out-of-pocket maximum. And the Medicare Advantage plans distinguish themselves from each other and from simply having Medicare Part A and B by offering additional benefits. And those vary from plan to plan. You'd always have to study the details of the individual Advantage plans to learn what additional coverages do they give you. It could be that they pay for transportation needs. It could be that they give you some degree of dental, maybe vision or hearing coverage. All of that is individually different from plan to plan. All of them are, just like the supplement plans are, regulated by the Medicare administration. CMS stands for Center for Medicare and Medicaid Services. That's a sort of a branch of the Social Security Administration that oversees all of these private carriers. They cannot operate just the way they want to. They have to follow certain rules. Any questions at this point?
Yes, I have a question.
Sure.
Great presentation, by the way. I'm wondering about, are there many doctors that don't take Medicare?
I don't have any exact numbers. It seems like a very large number of doctors will take Medicare. Mm-hmm. A lot of doctors will continue their patients when they, as we call it, age in to Medicare, right? They're turning 65, but they've seen that doctor for years before. They will keep them under Medicare, right?
Okay.
So typically, the network of doctors you have available if you have original Medicare plus a supplement is pretty large. However, there is a trend in the industry that more and more doctors join into medical groups, and the medical group associates with one or several Medicare Advantage plans. When they do that, they can say, we're not taking any people who have just original Medicare and a supplement plan. We only take patients that are in one of the plans that we have a contract with, in one of the Advantage plans that we have a contract with. Mm-hmm. In Santa Cruz County, the standing example is Palo Alto Medical Foundation, right? I don't know to what degree it's anywhere stated officially, but what we have observed is that Palo Alto Medical Foundation has a policy where they do not take new Medicare patients who come with original Medicare and a supplement plan. If somebody is a new patient to Palo Alto Medical Foundation at Medicare coverage, they want them to be in one of the Advantage plans that they have contracted with. They do seem to continue seeing people who they have seen, or some of their doctors have seen, at least the 2 years prior to their turning 65, and they continue to see them on Medicare plus the supplement, right? So you can see that there can be limitations, right? On the other hand, the limitation of a Medicare Advantage plan typically is that you have a network of doctors and specialists, hospitals, etc., in a specific geographic area. And every time you're outside of that geographic area, usually the county, sometimes a bit larger area than that, you get coverage only in acute emergencies, right? So if you spend 2 months in Montana, you can't schedule a regular doctor visit or go to a doctor for some minor medical situation and expect the plan to cover you. They won't. Usually, if it's a PPO, they might give you something. If it's an HMO, they typically don't give you anything, unless you have an acute emergency, right? So if there's a serious situation or an illness, from an accident, or an illness is getting significantly worse, and you really fear for your overall health and life, and you see somebody at an emergency room, they would be obliged to cover that.
Thanks. I had one other question. You touched on timing.
Yes.
And it reminded me, somewhere I saw that if you don't get the supplemental coverage in a certain period of time after you're eligible, that insurance companies have the right to charge you a lot more for that coverage later. Is that true?
Largely. The very last part is not necessarily true, but it's a really good question, and I'm glad you're bringing it up. Medicare has a whole section that just deals with when can you enroll into what type of plan, right? And to start with answering your direct question, Medicare supplement plans, in principle, you can submit an application for to become a member of a Medicare supplement plan anytime you want. However, with few exceptions, you will have to answer medical questions with your application, and the plan can decline coverage for medical reasons. Now, there are exceptions. The first and most important one is when you first become eligible because either you turn 65 or your Part B becomes effective, which is not necessarily the same time for everybody. People who work beyond their 65th birthday and have coverage from their employer can delay making Part B effective, which includes paying premium for it, right? And so the Part B effective date can be at a later point. When that occurs, that person would have a window of opportunity to enroll into a Medicare supplement plan without underwriting, which means without having to answer any medical questions, and therefore the plan not being able to decline them for medical reasons, right? This is what is called a special enrollment period. And there's a few others, but not a whole lot for Medicare supplement plans. One general special enrollment situation occurs if somebody has been on a Medicare Advantage plan for the first time and for less than 1 year, and they then decide, I want to, the Advantage plan doesn't suit me, I want to go back to my supplement plan or get a supplement plan for the first time, they have an enrollment window without underwriting to do that. But once you've been in the Medicare Advantage plan for more than a year, or in several different ones over time, that enrollment window, that special enrollment period won't apply. And you would have to answer medical questions, and the plan could decline you for medical reasons.
Thank you.
Okay. So yes, there's somebody raising her hand. Go ahead.
Rebecca?
I was wondering if there's a difference between the supplement and the Medigap plan.
No, that's the same thing.
Same thing.
Medigap is sort of kind of a popular way of saying Medicare supplement plan. The idea was that people realized that original Medicare, as it was created, had gaps. It didn't cover everything, and to fill the gaps, you would get a Medicare supplement plan. Medicare Advantage plans were introduced much later. Medicare supplement plans came fairly soon after original Medicare. Medicare Advantage plans started much later, right? And because the term supplement is a little loose, and most people talk about supplemental plans to Medicare, and by that mean everything that is coming from a private insurance company. Sometimes people think, well, a prescription drug plan is supplemental to Medicare. But strictly speaking, only the Medicare supplement plans, as I described them, should have that name. Yeah. Sure. And any other questions at the moment?
There's one in the chat, Manfred, that says, is there a clearinghouse that compares the supplemental and Advantage plans in one place? I'm 64 and would like to see all my choices in one place.
Not really. And that's one of the things, this would be a person for me to talk to individually at length and really go into the differences. One of the reasons to why that's not the case is that the Medicare supplement plans are standardized, right? So we don't have to do much of anything except looking at the table that shows us what do the different standardized supplement plans cover, whether what does a plan K cover as opposed to a plan F or G or whatever, right? Any of them. Because that's standardized and doesn't vary from company to company. In addition to that, the Medicare supplement plans are offered statewide. If a company is offering their Medicare supplement plan package, and they don't have to offer all the letters that are there, but if they offer their package in a state, they offer it anywhere in the state, right? The Medicare Advantage plans, that's a different thing. Typically, their geography is by county, and you will find, if you would go into that in Southern California, let's say LA County, San Diego, those areas, there's a lot more Medicare Advantage plans available than are on offer in Santa Cruz County. 3, 4, 5 years ago. 5 years ago, we didn't have any Medicare Advantage plans available in Santa Cruz County, period. And before that, there was one from Humana and went away, right? Now plans are on expansion, and there's more plans coming into Santa Cruz County. We've had 4 different plans available in the last few years, and we're going to have a few more going forward. And there, it gets tricky because they are not standardized at all, right? And so, first of all, for whoever had the question, the first thing I need to know is, what's your geography? Are you in Santa Cruz County? And then I can show you the number of plans available in Santa Cruz County, right? Typically, what narrows down a person's choices with Advantage plans are 2 questions that they would have to answer themselves or answer to me when I help them do the research, right? The first question would be, who are your doctors? Because you have now a network. And if you want a specific doctor, you need to see which plans is this doctor contracted with, so that you know that when you see him, those things will be covered by that plan for you, right? You don't want to go to a plan that does not have your doctor in it, especially in the case of an HMO, but even in a PPO, because your cost in a PPO for going outside of network is hugely greater than being in network, right? And the second question would be, what are your medications? Because, and this is an important thing, we get to talk about prescription drugs, prescription drug plans and the prescription drug plan that is integrated as a portion, as a part of your Medicare Advantage plans. All these prescription drug plans are structured in the same way because that's regulated by law, right? They have to do those things. A prescription drug plan will have a formulary. The formulary is the list of medications that they cover. So that's the first thing you want to know. Is the Medicare Advantage plan that you're looking at in the formulary that they use for their prescription drug portion of the coverage they give you? Is your medication in that formulary? If it's not, that's not completely excluding that plan as an option, but it makes things complicated and potentially costly. So you want to look very closely at that, right? So in other words, if a client answers those questions for me, that narrows down the field of plans that we have to compare. So there is no point in you having a table that compares all the Medicare Advantage plans throughout California, because you're not going to be able to buy them anyways, right? It's geographically limited and so on. Does that answer that question?
There were a couple of comments in chat, Manfred.
Okay.
One was that high cap is at Senior Network Services, and they provide some of that information. And also that the Medicare handbook has a list of providers.
Yes.
But it sounds like you'd probably need some assistance sorting through all that.
Yeah, I mean, the handbook that you can get every year from Medicare is like 100-some pages long, right? There's a lot of reading material there. It's very informative, and I obviously look at it. HICAP is a volunteer organization that gives people help in understanding Medicare in similar ways that I do, with the difference that they do have training as volunteers to do their job, but they are not licensed agents. And they are supposed to refrain from really making any recommendations. And since we're talking about this, there's an opportunity for me to say a little bit about what my role in that context is, right? I, as a licensed agent, I see myself as my client's advisor, right? I'm licensed and I'm appointed with all these different companies. I'm not in a position where I would have to favor one company over another. I can really look at your needs by having a personal conversation about what it is you need, who are your doctors, where do you want to go, what are your preferences, do you travel a lot, things like that, that help determine what kind of plan is best for you. And I do what I'm doing tonight in individual sessions as well, where I'm really trying to explain the differences and how these things work so that you as the client in the end can make an educated decision on what is best for you. How do you want to go about that? And the nice thing for you in the context, and in a way for both of us, the fact that I don't cost you anything. You're working with me, has no fee attached to it. It will not alter any premium amounts or anything, any costs on your end, because the way I get paid is not by you. I get paid by the carriers. The carriers pay a commission. I make it a point, actually, of keeping myself relatively ignorant about what the different commissions are that different companies pay, because I don't want myself to be influenced by that, right? I want to look at your situation, and let's say in the case of a prescription drug plan, if you're volunteering to let me know what your prescriptions are and I can compare the different plans to each other, I can say, and I can show you, with the numbers, that a particular plan seems to be the most economic coverage for your particular list of medications. And the reason this is important is because, unfortunately, the way things are, you cannot simply say, well, the prescription drug plan that has the lowest premium is going to cost me the least, right? I talked earlier about how prescription drug plans do have a formulary. That's the list of drugs they cover. What they do then is they organize this formulary into tiers, layers, and the designation to a particular layer for one drug determines what your share of the cost is when you get your refills, right? So if one plan, let's say two plans, A and B, cover the same prescription, right? But one plan puts the prescription on tier 3 and the other puts it on tier 2, right? And the plan that puts it on tier 2 says your share of cost of tier 2 drugs is $25 every time you picked up the drug from the pharmacy, right? The other plan puts it on tier 3 and says, on tier 3, the drugs that are designated to tier 3 cost $50, right? So you have a $25 difference in the refill cost for that particular drug. If the premium difference is less than $25, it doesn't make sense to go to the cheaper premium plan that puts the drug on tier 3, because you're not actually going to save money over the course of the year. Does that make sense? Right? So because of that complication, we need to take a close look. And the good news about that is that we have tools. Actually, Medicare, the government administration gives us a tool by which we can compare different drug lists against each other, and we can see which plan has the lowest cost over the course of a whole year, premium and and co-pays and everything included in the area where you live by zip code, right? So we can find out which plan is particularly good for your specific list of drugs. All right, so this is one of the things that I do for my clients too, to look into that and discuss it with them. All right. Are there any more questions in the chat? I'm not seeing the
I
chat.
think you've got it covered, Manfred.
Okay.
Yep.
And this is really the large overview. I don't know if anybody in the group, in the audience, is interested in learning a little bit about reducing costs. As you may be aware of, there are people who get Medicare and they also get Medicaid, or in California, Medi-Cal, right? Medicaid is the federal general program, and each state does its own. So there are different things to be said about that. If there's any interest in going into that question, we could look at that. If that's something that people might like to know. Let's see, I want to share this screen here to talk a little bit about money. I think I mentioned earlier the increases for 22, right? What is projected is for the Part B premium to go up by $10. One of the few pieces of good news we had recently is the fact that Social Security benefits are supposed to go up next year by 5.9%, I think was the number, which is a large increase relatively. Here is the other number. The Part B deductible in 22 is projected to go to $217 for the year. And this number here, the high income threshold, went from 88,000 for a single person to 91,000 for a single person. This is the cutoff. Anybody making more than 91,000 next year will be charged IRMA, and an increase in the premium for their Part B, and an increase in their premium for any prescription drug plans is basically a consequence of that. And in that context, something that might be interesting for people, especially those who are relatively new to Medicare, or have been on Medicare for a while, but still have been working and making more money, but now they're planning on retiring and their income drops. Medicare calculates its IRMA numbers, the premium determinations that apply for different people based on the income 2 years prior. So in 2021, they would look at your income tax return from 2019 and say, oh, you're making this much money, you're above the threshold for regular premium charges, we're charging you IRMA, right? And that can be quite unfair for people who had a considerable drop in income compared to when they were still working. And there are ways, there are options to appeal the Medicare designation for IRMA. So if you happen to be somebody who is charged above the standard amounts of $148.50 currently for your Part B premium, for instance, that could be something you might want to look into, and I can show you and guide you to where that information is be found, and actually get you the necessary forms that you need to file an appeal and get there. Rebecca, I see you.
Yeah. Does the IRMA include income from money markets and stocks and bonds and things like that? Is that included in the income calculation?
I think everything they include is taxable income,
Oh, okay, taxable income.
right?
Okay, got it.
Yeah.
There's a
Yeah.
question too, Manfred. What's the range of costs when you are paying for additional insurance to cover the gap Medicare does not cover?
So there is a significant difference between Medicare supplement plans and Medicare Advantage plans in that regard. Because the supplement plans are standardized, right? If you try to get fullest available coverage, you would look for a Plan G currently, right? If you're not eligible for Plan F anymore, and you can get a Plan G as a 65-year-old for about $100 a month, right? One of the things about the supplement plans is that their premiums are almost always age-based. So as you get older, every year your premium for the same Plan F from the same carrier will go up by some amount. And they eventually, when you start being in your mid-70s and upward, can get pretty expensive. All of a sudden you can be looking at $300 a month and more, right? Plus you have to have your prescription drug plan, and prescription drug plans vary from as low as about $10 to as much as $130 or so for a prescription drug plan. So it depends very much on what you need. The Medicare Advantage plans premiums vary hugely across the state. There are areas in California where you can get a Medicare Advantage plan with a 0 monthly premium, right? In Santa Cruz County, the premium range is currently is in $59 to $79, depending on which one of the 4 plans you look at. And the range is going to be a little bit wider next year in 2022. And those include, you don't need a standalone prescription drug plan, right? So it's something to consider and go over in a bit more detail to determine whether it's a good option for you or not. Depends on the individual person and their needs and all that,
I'm just wondering, related to that, I know every year during the enrollment period, can you change plans or change carriers, or how does that work?
Okay, so that is a question that we had touched on earlier a little bit and talked more about the Medicare supplement plans and the limitations that we have there for changing a plan or getting into a plan in the first place. With the Medicare Advantage plans, that is a completely different story. You can change from one Medicare Advantage plan to another every year during the annual enrollment period, which is where we are right now, right? every year between October 15th and December 7th, you can enter newly into any Medicare Advantage plan available in your geography, right? You have to live in the coverage area of that plan. That's a rule. You cannot have a plan that is being sold in LA County if you don't live there, right? But with that restriction, it's just the plans available where you live. You can choose any plan you want out of that array during that annual enrollment period. And there are no medical questions being asked. During other times of the year, you typically need a special enrollment period to enroll into a Medicare Advantage plan. One of those special enrollment periods is always that you're becoming newly eligible to choose a plan in the first place because you turned 65 or your Part B became effective or both, right? If that happens in May, you can buy a Medicare Advantage plan in your area without having to answer any medical questions. It's guaranteed issue, right? There are a number of other times special enrollment periods occur if you're moving and your current plan is not available in the area that you're moving into. You get to choose a plan and they have to take you. And there is also now something called the open enrollment period. The open enrollment period is the 3 months at the beginning of the year, first quarter of the year, basically January 1st through March 31st. During that time, you can change out of your Medicare Advantage plan into another Medicare Advantage plan or back to original Medicare and add a prescription drug plan if your Medicare Advantage plan included prescription drugs. But that's only one time during those 3 months, right? So let's say you currently have a Medicare Advantage plan A. It's it's annual enrollment period, and you decide you want to try out Medicare Advantage plan B, and you enroll into it. It becomes effective January 1st. All the plans that you enroll into during the annual enrollment period will become effective January 1st of the following year. You're into that plan, and in February, you have had 2 doctor visits, and it was a terrible experience, and you're deciding the network that comes with that plan is not good for me. At that point, you can decide, I want to go back to my previous Medicare Advantage plan, or you can decide I want to try out Medicare Advantage plan C, and you would be able to do that. And plan C or your previous plan A will not ask medical questions, right? You will be able to get that plan period during those 3 months. After March 31st, that opportunity is gone, and you're basically stuck with your Advantage plan for the remainder of the year.
All right.
Okay.
There's another question. There's another question in chat. How good is dental coverage? And I would add to that, how good is vision coverage? Is there any of either or both of those?
They are currently talking about possibly adding dental, vision, and even hearing to the original Medicare program, where it's somehow part of what Medicare covers. And then there might be a sharing coverage between the federal program and the supplemental plans. At this point, Medicare does not cover dental, vision, or hearing. However, some of the Advantage plans offer some dental, sometimes some vision, sometimes some hearing, or combinations thereof in their packages in the policy as part of your premium cost, right? And you would have to look at each plan individually because the coverage they include in their premium can vary considerably, right? And not all of them offer the same combination of things. So at this point, it's individually different, right? There's not the same offered from different plans. A lot of times, both the supplement plans and the Medicare Advantage plans give you an option to add on, so to speak, as a rider, additional dental coverage, but it usually comes then as at an additional cost. So there's a higher premium that you pay in order to get dental coverage and vision coverage, or both, in an improved fashion. Okay, so that is something that needs to be looked at in detail, but generally it's not something that automatically comes.
All right. I think Rebecca had a question. Did you have a question,
Yeah,
Rebecca?
Yeah, so let's say I started off with the Advantage plan. During open enrollment, I can switch back to original Medicare?
Yes, if you would decide, to go try out, so to speak, a Medicare Advantage plans by enrolling into it during the current annual enrollment period. It would become effective January 1st. And in a sense, you have sort of a look and see period of 3 months during which you can change your mind, right? But only one time. And you could, at that point, go back to original Medicare, right? If you've been on a Medicare supplement plan, you would be able to go back to your supplement plan as well because you've already had one. If you didn't have one before, you wouldn't be able to do that if this is the first time that you're on an Advantage plan, right? And if you do go back to original Medicare and your current Advantage plan, or the one that you just enrolled into and now leaving again, included drug coverage, you are also eligible to choose a drug plan, right? Because when you enroll into your Medicare Advantage plan, if it includes drug coverage, that enrollment will automatically cancel your previous drug plan, right? And the system does not want you to be without a drug plan, right? If you don't use that 3-month open enrollment period to make that change, you would have to wait till the next annual enrollment period. And at that point, if this is the first time and the first year that you're in Medicare Advantage, you could again go back to your supplement plan, right? But if you go beyond that, for most plans, you can't, right? Yeah, so the enrollment periods is a little bit of a chapter in itself. It gets easily confusing. The same is true for when you can get your Part B. And for people who are currently still with an employer, it'd probably be best to have an individual conversation about the details of what their options are. Can they get COBRA? What would that mean? And those things. It gets a little bit involved to determine what is their best option, because it really varies from person to person and the particulars of their situation. Okay. Yeah. Okay, Jack,
Yeah,
I
one
see.
more
you-
question.
yeah.
I'm wondering, would you generalize that if you're a senior in good health, that you'd probably save money with Advantage plans? Whereas if you have some health issues with the low premiums, but if you have some health issues, you should probably, if you can afford it, look more at the supplemental plans. Would you agree with that?
Yeah, that's, I guess, a permissible generalization. I would put it a little bit differently, right? If it's about your assessment of your finances and your health to see whether you want to take the risk that is involved in an Advantage plan. Financially, the risk is the maximum out of pocket, right? In a sense, if you're looking at how much does my supplement plan cost me, how much would I save if I change to the Advantage plan option, right? And compare that savings amount, look at that savings amount as a potential savings, because whether you materialize that or not depends on what happens next year. And we don't know, right? And so it's your assessment of your health, how you see yourself and all of that, and whether or not the potential savings is worth risking that if things go badly, you might not save anything. You might end up spending more than you would have staying on the supplement plan, right? That's sort of the pros and cons that you're weighing. Does it, yeah, that makes sense. Yeah. Any more? Any other questions?
It's a lot of good information, Manfred. And you covered it very succinctly and very well. So
yeah, and obviously I'm open for follow-up questions. Not everybody comes up with the questions right there and then an hour later they realize, oh, I should have asked this or that, right? And so I put the screen back up where you have my contact information. Email is great because it's time independent, right? I can answer an email at any time. But if people prefer to call, that's the number, and they can leave messages, and I will get back as soon as I can to people on either method.
yeah. And as I say, we have recorded this, and we will also include contact information for you in our newsletter.
Very good.
So, yeah, and if anybody ever wants to contact us to reach reach Manfred or any of our speakers, then we're happy to help make that happen. So, with that, thank you, Manfred.
Well,
Manfred, it was a
really
wonderful presentation. Thank you very much.
thanks for having me. It was a pleasure to be able to do this.
Thank you. That was really helpful.
All right. Take care, everybody.
Okay.
Bye.
All right. Thanks, everybody. I'll just give a quick introduction for next week. Or week after next, November 1st, our guest will be Joshua Slocum, who's Executive Director of the Funeral Consumers Alliance, and he'll be talking about what you might need to know about funerals. He's really a good speaker, very entertaining and very knowledgeable, and it's a nonprofit organization that helps you, like he was saying, that people can often be targeted by funeral homes that cost them more money than they might otherwise spend. And so that's only, one aspect that he'll be discussing. So tune in for that. And let's see. So anything else, Dave? Can you think of anything else we should let people know?
I think you've got it covered. You mentioned that anyone who would like to review this material can go to our website, and within probably a week or so, this presentation will be posted there.
Yep. All right. Well, thank you very much, everybody. Have a great day. We'll see you next time.
Good night, all.